Good afternoon. Thank you all for being here. My name is Dr. Velma Scantlebury, and I have with me Nancy Scott. And this afternoon, we are having this conversation about National Wellness Month. Yes, this is August. As we go into the summer, we think about what it means to take care of ourselves, what it means to stay healthy, and how can we do the best with what we have to really check ourselves, make sure we're making healthy choices, make sure we are practicing whatever it is, whether it's meditation, whether it's any kinds of self-care to keep ourselves fit and ready. It is also August, we celebrate National Minority Donor Awareness Month. And this is a nationwide observance that allows us to think about how we can improve the lives, quality of life within diverse communities, creating a positive culture for not only organ, but eye and tissue donation. Actually, it was founded in 1966 by Dr. Clive Callender, who is the founder of MOTEP, National Minority Organ Tissue Educational Program. And it started out as um, a day, and then it was a week in August, and now it's celebrated as the whole month of August. And this observance aims to heighten awareness of the significant need for organ donation and transplantation within the communities of color, not just African Americans, but Indigenous people as well as Hispanics. And so we have many reasons to focus on health this month and to also bring to you what it means to stay healthy and take care of ourselves. I'll let Nancy jump in and introduce herself.
Hi, I'm Nancy Scott. I'm the project manager for Dialysis Patient Citizens Education Center. And I live this story. I live it every day. Was on dialysis for 7 years, and I've had a transplant now for 15 years. And I'm so proud of this, what I've gone through, and still have a 1.2 creatinine. I'm also proud to say that the person that did my transplant is Dr. Scantlebury. So it's just amazing that, we still keep in touch. We work together now. And I used to wonder what people meant when they said a dialysis patient could be healthy. And it just didn't resonate with me. I said, here I am on dialysis, end stage renal disease. How am I going to be healthy? And the way I was healthy was being compliant, not over drinking, not eating the wrong things, keeping my weight down, getting the proper rest. And you are what you eat, and you really have to watch your diet. And another thing that I thought was odd was that, and when it's hot like this, they say stay hydrated. Well, I only could drink 32 ounces of water a day. So how do I stay hydrated? So I realized I had to plan on how many ounces I could drink per day, including the medicine that I took. So that 32 ounces included taking the medicine as well. Now, did I go over sometime? I'm not perfect. Yes, I did. But I never went in with more than two on. So you have to be mindful of it, and you can be healthy, and you can do many of the things that you always did. I went this week to talk to some new dialysis patients, and the questions that they asked were unbelievable, Dr. Scantlebury. Can I still go for a walk? Is my husband going to love me? Do my kids know what's going on? Are people looking at me and everybody knows that I'm on dialysis now? Well, you cannot look at a dialysis patient and know like it was many, many years ago. Dialysis patients look good. Many of them do. So a lot of myths that we hear, and I think wellness is a good time to talk about myths because you can't believe everything you hear. If you have a question, you should ask your provider. I know Dr. Scantlebury may have gotten sick of me, but I would ask questions because I was not a doctor. Yes, I'm a nurse, but I'm not a doctor. So I stayed healthy by being as compliant as I could, and I'm still trying to do the right thing because I went off the deep end again with a transplant. So that shows that I'm normal and I'm human. And when you fall off the wagon, which I call it, you just got to hurry up and get back on it because there are repercussions. So just concentrate on what you eat, what you drink, and that's as well as whether you've been transplanted or if you're on dialysis.
Yeah, and thank you so much for sharing, Nancy, because it's also important to understand that kidney disease is a silent disease, and whether you know you have high blood pressure or diabetes, often patients with these two main diseases aren't really don't really have discussions about the impact on their kidneys. And so you feel normal unless you have significant underlying heart disease where you have to limit your fluid intake or you're experiencing shortness of breath and trouble walking, you may not know that your kidneys are deteriorating. And it's so important to know our numbers, not just our blood pressure and our blood sugar, but also what is your kidney function and how is it impact? And the actual number itself is often misguides people because you can have a creatinine of 1.5 or 1.6 and still be and still be in a stage 3 renal disease. And so it's
Mhm.
important to one, understand your numbers and how you can take care of yourself to stay healthy. A lot of it is in what we eat. Some of it is in our genes and what we're predisposed to. But if whether you have stage 3 or whether you have stage 4 or you're on dialysis or you're post kidney transplant, there's a whole lot that you can do to preserve and keep your kidney functioning as best as it can be. And that's why, as Nancy was saying, now we know that before phosphorus was a big issue for patients on dialysis. And you could tell they were dialysis patients because they would get darker and the skin will be drier and pasty. But now we have better options, treatment options for high phosphorus levels, and those medicines allow us to um, provide patients with medications to prevent phosphorus buildup, and which can change the color, that lead to discoloration of your skin,
Mhm.
and more knowledge to the patient about what they can eat and not eat and how it impacts their overall phosphorus level, affecting the calcium and leading to arteriosclerosis or plaque buildup in the arteries, is a conversation that probably was not as prominent as it should be. And having patients understand is a lot easier to have someone understand why they shouldn't do something by telling than just telling them not to. The why behind it becomes critical and crucial for patients to say, well, I guess I can help. I can work on this better because this is going to be my lifeline. This is what's going to protect my heart. I need to drink less because if I come in with dialysis overloaded every time, then I'm impacting my heart and my heart function. And those conversations, I think it becomes important in educating. So patients, I think the more educated they are, the more likely we are to have a willingness to be more proactive in our own self-care and
Mhm.
staying healthy. So anything, what are your thoughts, Nancy? Did you really have trouble focusing on phosphorus when you were on dialysis?
No, I didn't. I really didn't. It was unbelievable. I did what they told me to do, and I didn't have a lot of problems. I was never hospitalized. I cannulated myself. I never had a fistulogram as a result of that. So my story is not a good example for those having a problem because I
Mhm.
really didn't. Um, of course, I had breast cancer at the same time that I was on dialysis. So I was on chemo and dialysis at the same time. And that took a lot out of me. So I had to wait 3 years before I could even get on a transplant list.
Mhm.
So 7 years I waited for a transplant, which is really not a long time when you think of how many people need a kidney. And
Mhm.
no, I didn't have problems. I never got those baths and things like they would get potassium baths. The only thing that I had a problem was keeping my blood pressure steady. And in fact, I was so weak one time, I fell out of the chair. I couldn't hold myself in the chair. So, those are the kind of things, crazy things like that. But
Mhm.
I felt good most of the time. And I was a big eater then. I used to love to eat. And I was thinking about where I was going to eat after the
Mhm.
treatment. So that's mainly what I thought about most of the time. But I did not have a problem at all. In fact, in my unit, we sat in these pods, and I would be so busy looking after everybody else because, everybody was busy in there. And I was spoiled. I dialyzed at the hospital for 6 months. So when they told me I was going to a center, I was really upset about it. I got warm blankets in the hospital, and, if I wanted a graham cracker or something, they gave it to me. So when you grow up and got to go to a center, separates the little girls from the women and the men from the boys, because it's some journey. It really, really, I don't want to make it sound easy because I didn't really have a hard time, but it is some journey. And you may not go through bad things, but you feel so bad for the people around you because many people are dealing with so many other illnesses when they are renal patients. And all I had to deal with was diabetes. And,
Yeah.
so it's different when you don't have a lot of complications.
Yeah, I think as we enter the summer and it's been hot some days. We had this
Mhm.
spell of really tremendous heat, and I know for patients on dialysis and the fluid restriction can be really an issue when it comes to limiting their fluid intake, knowing that it's so hot outside, and that's a challenge for many patients. Certainly, if you are on home dialysis of PD, you have a little bit of a leeway in terms of the frequent dialysis, and I did guess in and controlling your fluid volume, and that's why it's so important to control, find ways why we encourage at home dialysis, because you can have more effective dialysis more often and can benefit and have greater benefits as well than the 3 days a week, especially when you're trying to stay cool. And we usually have suggestions of, maybe make some popsicles, freeze your grapes, even in terms of fruit, put them in your ice cube, and being able to have them when it's cold. When they're cold, can be quenching your thirst and limiting your fluid volume. Because as people drink more and more because they're hot, then you run into more issues of fluid overload and congestive heart failure. So when we think about self-care and healthy, is about understanding what your volumes are, especially in the summer, and trying to figure out how do you get around that. Staying indoors helps, where you're not out in the heat and therefore have to worry about heat exhaustion, but also thinking about how to be creative in keeping cool when the weather is very hot, because that extra volume is going to impact your heart. And when we also
Mhm.
think about self-care, and you mentioned, Nancy, as you were talking about having been diagnosed with breast cancer, oftentimes we want to make sure that even though you're on dialysis, uh, it doesn't mean at the end of you that you're going to die because you're on dialysis. And so you want to be able to take care of your preventive health as well. We want to make
Mhm.
sure that you get your mammogram if you're a female, and you stay on top of your colonoscopies for prostate, as well as getting your prostate check if you're a man. I know many people are reluctant or don't want the idea of going through a prep to make sure in terms of cancer screening, colon cancer, but we have alternatives now. We have the blood test for colon cancer, and we have the Cologuard for colon
Mhm.
cancers. So you have options if you really dread getting going through the prep and having a colonoscopy. And so I encourage you that part of your that self-care and healthy and staying healthy is also about avoiding that trying to do preventively get your cancer checked so that you can stay healthy and not have to have a late diagnosis, which is often can be very detrimental. So if anything, you want to catch it early from and be able to be treated. And you see, Nancy had our chemotherapy and while on dialysis, she got transplanted, and here she is 15 years later. So truly a miracle, and still God still have work planned for you to do. So
Mhm.
part of that is certainly, one of the things we want like to encourage patients and staying healthy. So also for self-care, one of the things we often neglect is the emotional state of
Mhm.
patients who are on with end-stage kidney disease. For some patients, it's an acute diagnosis. They didn't know about it before. This is something they're learning of within a few months, or learning that they have to be on dialysis in a short space of time, and that can be pretty traumatic. A lot of people feel that there's a stigma behind being on dialysis, and they don't want to talk about it. They don't want to share it with their family. They feel embarrassed about it, um, and it's hard to for them to get from under that place. And oftentimes there's, seeing a therapist, talking it through with them, understanding that this is a disease process that you may or may not have had any control over, but right now this is where you are at. And I know from mental health, it can often also in itself be treated like a stigma. But we now have many celebrities, actors, actresses, uh, everyone whose lives is touched. There are so many people who have now normalized the whole idea of having a therapist, and the fact that that's often what's needed along plus or minus medication, depending on your state of health, to get through your mental health. And it's quite normal with those feelings. So don't feel like you are different than anyone else. The best thing is to seek help and not stay in that state of mind that can lead to destruction, not only mentally but physically. So again, self-care is taking care of you. Even, I'm going to make a comment about the caretakers. Sometimes we ignore the people taking care of the patients on dialysis, or their partners, or their loved ones, and they also can feel like there's a heavy burden of taking on them being able to care for their loved one. And so we need to think about how do we give the caretaker time so that they can stay healthy, and so they can also have some element of self-care, whether it's a short time off, alternating with family members, different ways to be able to have that time where they can just step away and take care of themselves. And that's crucial. And so uh, I'm turning it over. See, Nancy, any topics you want to touch on?
Well, you touched on the mental part of it, and I'll just do a plug for the kidney chat that we have, the support group. We're having Dr. Stacy Obede, it's Ogbeide, and she is going to be our guest next Tuesday at 2 o'clock, and it's via telephone. And I would suggest you check our website to get the phone number. And we don't use our last names, and it's very confidential. And a lot of times, and we do it via telephone. So if you have any questions that you may not want everybody to know, that would be the perfect time for you to come. And also remember that all of these roundtables, and there's one every month, you can see it on YouTube probably within a week or so. I don't want to give you a definite time frame, but they're on, and all the rest of the roundtables that we've done. And this is our kind of anniversary year. We started August 2025. So we've been doing this a year now, and it's just been really great and a lot of very interesting topics. So just keep in mind that this is recorded and you can see it on YouTube. Um, and also, you made me think of Dr. Obade because a lot of people are afraid to go to a therapist because they don't want anybody to call them crazy. And if you're having a problem mentally, a therapist can be your new best friend. Sometimes we just can't work it out. Dialysis is some journey. I really mean it. And like I said, it's not for the weak. And if you can't handle it, it's really going to get to you. So let somebody help you get through this to deal with your mental state. That's why so many doctors have specialized in different specialties. Dr. Scantlebury is a nephrologist. She deals with that. You know, there's a doctor that's a cardiologist. So why not go to a therapist and let them help you if you're having a problem? And then you have to have the right mindset too, not just mentally, but for your physical health, your wellness. You have to get the mindset that I want to live. I want to eat to live and I want to drink to live. So don't go to dialysis and then come home and drink a 2 liter bottle of soda. You've overstepped. You have overstepped. So, and you're going to pay for it when you go back. I've
Mhm.
never had a lot on me, a lot of fluids to go in. Sometimes I say, Miss Scott, did you drink it all? But when you drink the amount that they tell you to drink, you're never overloaded. So you just have to have the right mindset if you want to live. And also, I was older and I'm 75 years old now. So if I can tell you that, and still be sitting here talking to you relatively healthy. No, I'm not a young girl healthy, but I'm relatively healthy. And that's because I want to live. I'm not ready to leave the planet yet. And I think that's part of it. You got to have willpower and discipline
Mhm.
when you're on dialysis.
Absolutely. And I'm going to correct you in that I'm a transplant surgeon, not a nephrologist, but
Did I say nephrologist?
yes, but
You
that's
know I
okay.
know. You know
But
I know.
I also wanted to, also for patients who, I mean, not only is just being on dialysis, it's the anticipation and the hope of getting a kidney transplant. For some people,
Hmm.
it's so discouraging, year after year waiting to, and maybe
Yeah.
even getting called, but or and getting turned down.
Hmm.
And there's many people who, especially if you're, well, A and O are the two common blood types. So for patients, those can be, depending on what area of the country you are, it can be very devastating in that you
Yes.
wait years, and it could be 10 years and you're still waiting, and
Hmm.
your heart function may be getting worse. And also for patients who are post-kidney transplant, not everybody does well. Some people
Hmm.
face with rejection. Some people have virus infections, even though it's the minority of patients, where they have antibody-mediated rejection that's difficult to come back, and they are struggling with that kidney. And for some, a small percentage will lose that kidney and have to go back on dialysis. So I think we all struggle with or issues, and whatever they may be, uh, it can affect us mentally. For some people, they may not have, they may be the caretakers and having to deal with their loved one's health deteriorating, or the fact, or a parent not being able to donate to their child. And so there's so many things that mentally that can get us down, that is often about how can we get to a place where we can take care of our own health, It's almost like, when you hear about the fact that you got to put your own mask on the plane before you can help your loved ones put the mask, because if you're not there to do it and they're not able to do it, then you both suffer.
Right.
So it's so helpful to be able to do that. So this whole session is about self-care. What do you need to do to put yourself in a better position to have a healthier life? What can you do to improve your dialysis outcomes? And Nancy talked about don't come, don't get off of dialysis and drink 2 liters of fluid because you're lightheaded after you get home. Because
Mhm.
one, you may be lightheaded because your fluid volume was way up and they had to take tremendous amounts of fluid off of you um, to bring your dry weight down. And so they've squeezed you like a sponge because your weight was already over. And then you go home and now you're putting more weight back on, which creates another cycle of being able to go through the whole process. So how can you break that cycle and be able to say, what do I need to do to get to have healthy habits? How much do I need to decrease this fluid by? If I'm eating too many beans and my phosphorus is up, what percentage can I cut to be able to keep my phosphorus normal? Sometimes it may be that doesn't necessarily mean you cut it out altogether. It may mean that you just need to change your portions so that they're healthier and you don't suffer the consequence of the bad side of that consumption. So self-care, you talked about going for a walk. Just because you're in dialysis, it doesn't necessarily mean that your feet aren't working. So as long as you have two good legs,
Right, right.
and you had two good legs before you started dialysis, then you may still be able to continue to exercise. Remember, exercise keeps your heart healthy. It
Right.
keeps you want to push that heart. If you don't have underlying heart disease and you clear it with your doctor, then you want to be able to continue the healthy habits. Not when it's 95 degrees outside. If you feel like you still need to go walk, then you go to the nearest mall or someplace indoors so you can not have to suffer the consequences of extreme heat. So for each one of us, it's really about what do I need to do to practice better self-care? Do I need to change my eating habits? Do I need to reach out to someone if I'm in a place of where I feel alone? Maybe I need to find a group or see who I can relate to, who I can call to really talk to someone? Do I need a therapist? Who do I reach out to? And Nancy said we have these kidney chats that can also give us good information, and you can make those listen in. You don't have to say anything, but if you have a question, you're only on the phone. So there's an opportunity to also be able to have your voice be heard. So we have 1 minute. I'll throw it over to Nancy to give us some closing remarks.
Well, I just wanted to say these roundtables are about education. And just like anything else, in the words of Maya Angelou, when you know better, you do better. And I think if we remember that, we can get through this journey together. You are not alone.
Yeah.
Thank you very much.
Thank you all for being here and have a wonderful afternoon. And we'll see you next time. So enjoy, be blessed, stay healthy, stay safe, and remember gratitude, practice gratitude.